Okay, so I would like to talk a little bit about latching. Your baby sometimes can naturally come onto your breast and latch just very naturally, a nice, perfect latch, and you don't have to do any adjustments. And that's best achieved by bringing your baby very close to your chest, tummy to tummy, and you'll look to see that you'll see the ear, the shoulder, and the hip are all in one line, his tummy up against your tummy, and when you go to attach him, his nose is right at your nipple. And other times you might find it easier if you use your other arm to bring the baby in. His arms might be moving all over the place. It's easier to get more control if his head is lined just at the nape of his neck, right in your palm here, cradling him in, tummy to tummy, and you have control, you have the support against his back. He's in the forearm here, and he comes right in close to you. Sometimes your baby doesn't want to be put into a position, and you'll find you're fighting against his arms and both of you are just having a harder time. In that situation, you might try the self-attach technique, which is your baby using all his or her natural instincts to latch all by themselves, because they are born with the instinct to nurse. So it's fun to even try that, and oftentimes you'll find that's actually going to get you a really great latch. So you lean back in your chair, maybe in a couch with a propped up, in a semi-propped up position, almost reclined but not quite, and you just let your baby come right to the center of your chest. You'll have pillows on either side, so for your elbows and your baby's feet. Your baby can be at any angle on your body. Feet down here, feet off to either side, even over here as long as there's something to support his feet, because he naturally wants to push and crawl up your chest. So he's on you tummy to tummy. Again, always tummy to tummy. And the weight of his body just elicits him to lift his head and search for your nipple. So you don't want him crying, you don't want him overly agitated. You just want him in a quiet, alert state where he's calm and relaxed but eager. And he can then crawl his way to find your nipple. He bobs around, kind of like that, looking for your nipple, and he finds it simply by smell, by sight, and by tasting. He actually feels the nipple finally, maybe on his cheek, which elicits his rooting reflex to then find the nipple. He bobs on and latches. And oftentimes that's your best latch, because he did it all by himself. And there's such a sense of satisfaction for both you and the baby when it happens like that. And the more conventional way is with the pillows, baby laying up against you. You could rotate around to the side, which is the exact same thing as on this hand for this breast. Rotate to the other breast becomes the football or the clutch hold. So it's the same exact thing. Baby's mouth is up and down. You position your breast to sandwich it to fit the mouth, or he can be on his back, in which case you change your positioning of your hand. He comes up and over your breast this way. You can see that just by pressing back and looking at your own breast to see how the baby's latched on. Most important is, how does it feel? If it doesn't hurt beyond the first few sucks, your baby's doing great and you don't have to adjust anything. But again, if it hurts throughout the feeding, and more than just a pull, more of a pinching, then perhaps some damage is being done and you need to double check how this baby is latched on. So again, I'll just sort of set up how you might do that. You put a pillow around your lap. It'd be either 3 pillows, 1 in the front, 2 on each side, or you could do a boppy, which is a 3 in 1. Some women who are long-waisted might need 2 pillows, so that when your baby is laying up against you, right here, head, and the feet are over here, this would be as in the cradle hold, your baby is then right at the level of your nipple. So he's way up here. You don't want to lean down to get your baby to latch on, because then when you go to adjust, he slips off. So you want to be up at the level right here. And bring your baby on, and using your hand, the other hand, you can take your nipple, right at the base of your areola, just behind your areola, squeeze it in, just like you would a sandwich, shaping it to fit your mouth. So just like you go to eat a sandwich, you open your mouth wide, you lay it in, and you can get a much larger amount into your mouth. Same with the baby. Your baby's mouth is now up and down, squeezing your areola like this. His little mouth, this is a very big mouth, comes at the base of your areola, up and over. And you do that simply by holding the base of his neck, guiding him. Wait for his big wide mouth. Your hand is down here making a U shape. His little mouth then opens. Catch it right at the base, and when he's opening, it's like just a quick open moment, and you bring him up and around by guiding the back of his head. Wait for his big wide mouth and just kind of guide him up and over. So if you're having any trouble at all to get a nice deep latch, that's a helpful little tip that can usually resolve a lot of problems with needing to be deeply latched on. So that's something that takes practice. You'll get better at it. So be very patient with yourself, because that's something that really sometimes takes a while to achieve. If you're having ongoing discomfort, meaning it's pinching, your nipples are cracked, there's any bleeding, scabs are not healing, please do seek some professional help. It's always good to get a lactation consultant in to observe the baby's mouth, how they suck, and how the baby's latched on, and even your positioning. Sometimes you just don't notice. It's important to be sitting nicely in a chair. You want to have something even relaxing at the base of your neck so that you could even lean back in the end once you're comfortable and fall asleep. Because you do this a lot. It's like 8 to 10 hours a day of nursing. You want to be comfortable. You want to maybe have a stool for under your feet so that you can relax the lower back. And again, every part of your arm should be absolutely relaxed. Pillows under your wrists. You don't want to have any bent positions of your hands. That can lead to carpal tunnel syndrome. Everything should be absolutely supported and relaxed. Maybe someone can come along and give you a back rub. In the beginning, everything's a little tense because it's all brand new. But it gets easier and easier, so be very patient with yourself and your baby, because the two of you are a team doing this for the first time, and you will become professionals.